Hey everybody, welcome back to Read the Tape. I'm Rodney Matthews.
I'm Mike Shapiro.
And on today's episode, we have the world-renowned Dr. Daniel Shapiro. Dr. Shapiro, not to be mixed up with Mike Shapiro, okay? This one's just a little bit smarter. No shot to Mike.
Yes.
No, I'm playing.
Much smarter.
No, we're really excited about today's episode. And Mike, thank you so much for bringing Dr. Dan. How'd you two meet?
Oh, boy. I think we met at social events in Arizona. So I think our wives were very active socially, for lack of a better description.
Yeah.
So I think we were always in tuxedos.
And you guys have known each other for how long now?
I think it's 30 years, at least 30 years. So long time.
Okay.
And we were kids.
Oh my God. All right. Well, I can't wait.
We
to
were
have
your
them.
age.
Yeah, that's a throwback right there, okay? Shout out 92 babies.
There you go.
All right, we're really excited to have Dr. Dan. We'll get right to him right after this break. All right, we are so excited to have the well-renowned Dr. Daniel Shapiro on the show today. Mike, it's one of your friends, right? Can you tell us a little bit about him?
Long-time friend. Dan, I think we've been friends for 30 years.
30 years.
30 years?
Long time.
And he still looks the same because he is a plastic surgeon. He looks exactly the same.
I'm in the business.
He's looking good. He's
And I
looking
look
good.
30 years older. So,
Okay, there you go.
But yeah, Dan and I are good friends, old friends,
Old
and
friends.
Dan has had an incredible career. I consider him a super genius.
Not a genius. Just work hard.
He's extraordinary. He's also, you actually train Mayo surgeons.
I do. Yeah.
Which is an unbelievable honor.
It is. Yeah.
And I think
Thank
that
you.
your story is fantastic. So why don't we just take it away? Why don't you tell us a little bit about yourself?
You know, I know this is a business kind of podcast,
Yes.
and I feel like I'm here to tell just about anybody they can do anything if they believe in themselves. And I know that you talk about that in terms of your themes and what's important. So I am from Arizona, and both my parents were doctors. So back when I was a kid, if you were smart or maybe not so smart, you go to medical school, you go to law school, or maybe take over your family's business. So from a young age, I kind of knew that I was going to be a doctor. I remember being as a kid, I used to look at my mother's Vogue magazines, and I'm sure at some point they thought I was going to be singing show tunes in the shower, you know what I mean? But no, I was really obsessed with women's faces and what made someone beautiful and not beautiful was really millimeters, and I kind of thought that way. And I also recall looking at an article and actually taking it out of Newsweek magazine back when I was a kid, and they were talking about how convicts in prison, when they are let out into being, free citizens, if some of them, and it was a study, if some of them had plastic surgery to improve their appearance aesthetically, there was a lower rematriculation rate into prison because of how they are perceived.
That's fascinating.
Yeah,
Wow.
how they're perceived and I think how they would act. So I was always interested in, I think, being a plastic surgeon. And I'm ashamed to admit this, but really what clinched it is one of their best friends was a plastic surgeon in Phoenix when there were not many plastic surgeons. And I would go visit his office, and he had this beautiful office, had beautiful women working there, and had great cars. And I'm like, I can do this, okay? So I went to college, and then I went to medical school in Tucson, and I always wanted to train back east. So I did all my surgical training and plastic surgery training, ended up in Manhattan, was going to stay there, but and I had it all planned out. My office was on Fifth Avenue overlooking Central Park.
Wow.
But the
I
guy
didn't
was,
know that.
yeah, and I had a job. But the guy who I was going to join kind of went through young partners like Chinese food, if you know what I mean. So
Yes.
I'm like,
I love Chinese food, but it's
yeah, I
kinda
love
like,
Chinese food, but you
why
want
are you always
to.
hungry after you eat Chinese food? It's kind of
I know, it's
true.
So I decided to go back to Arizona, and that's when I started my practice. That was
Wow.
in '92.
That's interesting.
Yeah.
So you
It's the
pretty
year
much,
I was born. Shout out
That
to
is
92.
frightening.
Rub it in.
dude. That's
Thank
frightening.
you very much. We feel
Shout
really
out to
old, yeah.
90.
I feel
92.
really old now.
Yeah. So you kind of knew, like, your passion, like, this is about also, like, people's passion following your dream. So you really kind of knew it. It was, like, part of your being.
Well, yeah, and I didn't really know what it was about, but I knew I wanted to do it, if you know what I mean. There were some mentors that I had mentally, and I knew I wanted to be at a certain point doing that because it looked great and I thought I had an aptitude for it. And then as I went through surgical training, I was told I was pretty good technically, but you never know, so
Sure.
it was a risk. But I didn't have a wife. I really had no responsibilities financially. So when I got back to Arizona, when I was in New York, I was lucky enough to be trained and exposed to some really amazing stuff. I mean, we had great aesthetics there. And also I trained at a place called Sloan Kettering that they did all the
that's amazing.
cancer therapy for surgery. So when I got back to Arizona, there were already plastic surgeons there that had trained in Arizona. So it was hard for me to break into that group, if you will, the surgeons that knew the surgeons that they trained with, et cetera, et cetera.
So it was a clique, sort of.
It was kind of a clique, yeah.
Really?
So
That's interesting.
it was kind of hard for me to get those referrals doing reconstructive surgery. So I already knew aesthetic surgery, and it kind of came easy to me. So that's kind of what I did. And I remember I lived in an apartment with no furniture. I had no responsibilities, so I took everyone's call. That means trauma call. So I would wake up or be up all night doing, facial fractures or dog bites or whatever. And I
Remember
would
I say take every call?
See,
every
single
call, man.
call.
You don't
That's
turn
why.
anything down. And in my mind, I would say, okay, that facial fracture, that's going to be a chair for my waiting room.
Wow.
So I in my mind, visually, I planned and built an office that I thought represented me. And this was in what was North Scottsdale, which was like, it's grown immensely now. It was nothing back then.
1,000%.
Yeah.
But in my mind, I always thought plastic surgery was special. So I kind of equate it to when we were kids and you go on a first class flight, people used to dress up for that.
Right.
So now, yeah. So
anymore.
I always thought plastic surgery was
sweatsuit now.
special. Right, nobody does anymore. I thought plastic surgery was special, so I built an office that was really beautiful, that was really for me, but because it kind of gave people my idea aesthetically of what I was thinking. And it was something I was comfortable with. So anyway, the rest is kind of history. And I also kind of lucked out PR-wise, because PR is important in building a business. I was sought out when I came back to Arizona because of my Sloan Kettering connection. It's not too far to remember, but there was the Bosnian War back then. So there was a Bosnian War victim that was sent to me who lost half his face by a sniper's bullet. And they wanted me to reconstruct his face. And little did I know that, after doing all this, and I sent him to UCLA for a special kind of prosthesis, and I didn't ask for it, but I was on the front page of the paper twice within a matter of, 6 months.
Wow.
And that was really, lucky for me.
Well, I mean, you changed someone's life. You
Yeah,
helped them.
but
We
I mean, the PR, it
just-
exposed to me, a lot of people, and simultaneously, if we're talking about building a business, I always thought that branding was very, very important. So
Yeah,
this was
yeah,
back when it was cool, when not cool to advertise, all right? So I thought, well, I want to build a brand, and I looked at some of the brands that I knew, let's say like Ralph Lauren and some of the cosmetic companies. And I thought, well, I'm going to do some branding, but I'm not going to really say much about myself because I had no history yet. So I joined up with a friend of mine who owned the modeling agency, and I did a campaign of visual representation of what I thought plastic surgery was.
Wow, that's really
And
interesting.
yeah, and it was way before. I mean, I'm lucky. It was way before its time, and I picked out some words that I thought were important for conveying that, and
So
I
it
did
really,
a campaign.
really was marketing. So it was part of your narrative. I mean, other than, being a plastic surgeon is a different type of doctor. Where
Correct.
you really are an entrepreneur. You really have to build a
Yeah,
business. So, for the most part,
Right.
the bills are, obviously there's a lot that you do for reconstruction or people are in accidents. Probably the most, we were just talking about it in the car, the most satisfying part of your job, but the end result is a lot of this is elective.
Correct.
And that's how you pay the bill.
Correct.
So at the beginning, you really knew that the narrative or the marketing was important.
It was important because I got back and I felt a little shut out because I didn't train there. And I knew I wanted to be somewhere, and I thought that it was fertile grounds because it hadn't been done before. And I've always felt as though whatever I've done, I've always kind of tried to think outside the box a little bit.
So you were the first one to really think that way as far as, I mean, that goes
branding,
back a long time. From a
branding
branding
wise,
point of
right.
view and using sort of an analog, if you will, like the modeling, associated with like not
Exactly.
saying right in your face as far as plastic surgery.
No,
but
it was
like,
very subtle, but
Right.
it really rocked a lot of boats there.
Wow.
That's what I was going to ask. Is
yeah.
what other like marketing tools did you have to use in order to continue to build upon your brand?
Well,
at that
I
time?
think that the beauty is that if you're lucky enough to be able to get good results, that's your marketing.
Exactly. Word of mouth.
Yeah, the word of mouth. But I think that what's different is that people didn't think that way yet, at least in Arizona. And I'm kind of the person, as we've talked about this, that I'm most comfortable when I'm a little uncomfortable.
Okay.
And I like that, and it kind of drives me. So that whole portion of my life was building, and I knew where I wanted to be. There were some mentors that I had that were more in my mind. So there were more mental mentors in terms of practical mentors. But I always knew kind of like where I wanted to be.
Wow, that's really interesting.
Yeah.
I like this sort of the entrepreneurial spirit, the creativity, and so that really leads into what you do for a living. I mean, it's artistic. I mean, obviously there's
is, yeah.
you're a doctor, and it's very serious, and people could potentially die on the table. And
Right.
So I mean, there's anatomy and all
Right.
the structural aspects to this, but it's artistry. Like, how do I make somebody look better? And it's all part of this whole. Part of you, part of what you do, part of how
It is.
you express yourself.
It is, and also, if you're talking about being successful at what I do, it's being able to predict what makes people happy. So,
Wow.
yeah. So
Is that in the interview process, or is that part of
Yeah,
how do you do that?
it's a very quick process that you get better at over time. So when I meet with somebody for a consultation, I think the vast majority of what I do is more facial now. I do a lot of facelifts and rhinoplasties, and I do all the kind of body stuff. But I think as you get older, you kind of mature into that kind of practice. But when I sit down with somebody, we've talked about this. I'm looking at everything. I'm looking at their demeanor. I'm looking at what they're wearing. I'm looking at how they're carrying themselves. I'm looking to see what I think the threshold is in terms of making them happy, and what needs to happen physically to achieve that, whether it can be done or not. So and that is really what I'm looking for now.
So you refuse sometimes. If
I
it's
do
not linear.
all the time.
So, Dr. Dan, it sounds like to me that you have been reading the tape.
Love it.
Right?
Read the tape.
No question
That's what it
about
sounds
it.
There's
like
a
to me.
book right there.
Right. Without knowing what that book was about, I've experienced the same thing, and that's what is just so amazing about what you guys do, because it's across the board. It really doesn't matter what you're doing. It's the template of being authentic and trying to assess the situation. So in very many ways, when I meet with a patient, I am reading the tape within about a minute or two.
Wow.
In terms of trying to gauge what it is and what that small marketplace is at that time, and whether I can be successful or not.
Did you feel like you always had that quick read on somebody instantly, or over time it was able to get quicker in terms of being able to read that body language, read demeanor, and read what it's going to take to make that person happy after the procedure?
Well, that's a great question. I think that as I've gotten older, I was raised in a different background than Mike, and I don't know about you, Rodney, but Mike was in a nurturing kind of background that focused on positivity.
Yeah.
As though his failure was something to embrace because one
Yeah.
could grow from.
Yeah.
Whereas mine was, just the opposite.
Yeah.
So
Wow.
I didn't have a lot of confidence until I was older to understand that I have those attributes that I could trust. And that's one of the things when we talk about training people and being aspirational for people, I think you have to know who you are. and
This is sound advice. This is great.
yeah, and accept those things. And those things, as a teacher, those are things that, as Mike does, I try to nurture with the plastic surgery residents that I teach. So one of the basic things I talk about when I meet them, they're with me, and it's very intimate. I'm with them for 3 months, so this is every day. I'm with them in surgery. I'm with them in consults, and I'm trying to make them better. And it's not always being nice to them. I mean, I want them to have their potential, but one of the first things I say is being successful is looking yourself in the mirror and think, what am I good at? Because that is the pathway of least resistance, and that's the way you excel and find the niche that you're best at.
Can you identify, like, with, I know that you've said privately that it's one of the most satisfying parts of your career at this point is like teaching and
it is. It's great.
And mentoring and getting people to the best of their potential.
Yep.
Can you tell rapidly? I always say I consider to tell rapidly if they're going to succeed. Can you see it? And is it something that you feel like you can correct, or
well, it depends. Anybody who comes into my practice, and these are people that are generally 30 to 33, 29, 33. They all want like my practice, because it's on the outside, it's glamorous, and it's
well, you're one of the biggest practices.
Yeah, but they don't realize that it's a lot of hard work, and things aren't as glamorous on the inside. That being said, I see a gamut of these people that come into these programs that personally I would not get into these days. I mean, that's how competitive it is.
Wow.
These guys are superstars. Yet you identify somebody once in a while who has the it factor. And
what is that? How would you describe that? Personality?
It's a rare combination of technical ability that is natural. But a lot of that, I'd say you get somebody to 90% technical aptitude, and that's good enough to be fantastic. But once in a while, somebody has a gift. And when somebody has the gift, along with the ability to communicate with people, and has the look, if you will, without trying to create a look, they just have that comfort with themselves. And,
that's
the
the
it
board.
factor.
It's
across
so
the board.
true about every single career. I always say, athletics is a great way to describe it.
Yeah.
So, one of the greatest athletes of all time is Michael Jordan. Not only
No
did he
question.
have the passion to produce, but he had the genetics. So
Correct.
similar. You have the genetics, and you have the passion, you have the talent, and it's like you can become a superstar. Yeah. So you can see that, right?
Right. And that pathway might be different, for other doctors, in the sense that some plastic surgeons come in and their gift is to be teachers or to do research. Or one of my best friends, and this is how I was recruited to Mayo Clinic. I was recruited because of my facelifts. And this guy is one of my best friends.
That's a huge honor. I don't know that people realize.
No, I appreciate that.
No, you're very humble, but I mean,
no,
it's considered one of the top.
It is every
if
year.
not the top
hospital every
hospital
year.
for
This guy
surgery,
does face transplants.
Yes.
If you can imagine that,
Wow.
face transplants,
It's state of the art.
just unbelievable.
my
and
God.
so that's what I'm saying, that the mentorship is so important for people to have something, either emotionally or rationally that they can aspire to and have a role model for that.
Wow.
Yeah.
How do you stay so? I mean, this sounds funny, but I mean, I know you for a long time, but you're always humble. You're you have achieved. You're not going to say this because I'll say it for you.
I
But,
agree. Yeah.
You're considered one of the top plastic surgeons in the nation.
Yeah.
Certainly in Arizona. I mean, you have accolades after accolades. How do you keep that? How do you enter that so humbly?
Well, because
what's a part of you?
No, it's. I mean, we've all had setbacks, and it doesn't matter. What they say. It doesn't matter how you stumble. It doesn't matter if you stumble. It's how you get up.
I agree with that.
Yeah. So I mean, I've had, and I'm free to talk about it. I've had setbacks. Either economically when the .com bubble burst. I mean. One of the first things that happens within the economy is people cut back on what we do. Yeah. So you can be great at what you do, and then all of a sudden it dries up because people are not spending the money on elective surgery.
Exactly.
So you have to pull yourself up and find ways of maintaining, so economic security. So during that time, I remember that, I did some spins on certain procedures that maybe were more beneficial for people that wanted to put their toes in the water or were more affordable and things like that. So you survive and you try to get better, but it's so unpredictable in terms of what happens economically. But I'd say, my biggest stumble that really changed my life is that, and this is back just about this is after you moved, but this is around '08, and, I was working nonstop and we're building a new house, and, you go through periods in your life where marriage is good, marriage isn't good, and I found myself on the weekends, we were doing a lot of black tie stuff and, drinking. And I was trying to curb that, and it just kind of fell apart. And I ended up going to rehab.
Wow.
Yeah, rehab. So not only that was on TV. It was really bad. Okay.
Yeah, thank you for
really
sharing
bad.
that.
Yeah. So I went from literally making millions to having to support my practice in '08. And that was when everything fell apart economically. And you just have to survive, and you dig deep, and it happens to a lot of people, whether in your real estate, real estate has cycles.
Sure.
And you hope that you don't overextend yourself or over leverage yourself so you can survive. But I found that afterwards, you have to reinvent yourself, or I had to, and I did that on a very in a very planned kind of fashion. Where I sought out some procedures that were not being done. There was something called high-definition liposuction that was way before its time. This was in '08. I went to Columbia 3 times to learn it, and it was an incredible procedure. It's very artistic kind of liposuction that defines musculature, and I was doing that a lot. And I had a whole, you talk about different marketing. So whenever I would introduce a new procedure, I would have a whole campaign. I would have, I was lucky enough, I was on TV all the time. So I was kind of like the point guy for TV. So I would do a TV kind of program. I would do some things on the internet in terms of providing a platform for that.
Do you feel that like the stumble, which I always think great success is always from failure.
No question.
Do you feel that stumble mid-career has made you much more successful than you ever would have been if that didn't happen? Do you feel that I know, like, it's hard to, like, reverse, but do you feel that was an important part of your being? It was
a huge important part for me in terms of emotional growth, because I think that you feel as though, and especially when you're younger, that you are bulletproof, and you're just not.
I don't remember those days anymore.
I know.
What
they say, oh my God, I know. It was a life-changing thing for me because it made me focus less on myself and look at the picture in terms of my family, in terms of a little bit more life balance. And it made me not take things for granted. I mean, it's just, success is not a given, and it can be taken away at any time.
Well, I mean, you've really taken, I'm not trying to say that I try to teach this, but you've literally gone through the entire cycle of success, like from pivoting to changes to being prescient, seeing the future, being creative, understanding, constantly reinventing in order to be successful. I mean, you're doing all these things. It's like a natural part of your being, which is fantastic. You're like the perfect entrepreneur as far as, and your journey. And what does that mean? So,
well, I think that, having gone through the whole sobriety thing, I've been sober since '08, is that humility.
That's amazing.
Yeah, humility
Congratulations.
Thank you. Yeah, humility is something that really, I think that either you have it or it can be learned, in the sense that
I love that line.
Yeah,
you think someone can be
it
learned?
Can be learned. I mean, it can be learned because
figure it out
it's
real
necessity.
quick.
Right.
And I guess that what comes out of that is realizing that for me in a mature life, it's not what I want, it's what I don't want. And something very, very valuable that a mutual friend of ours who incredibly successful, Randy Knight, remember Randy Knight?
Yeah,
he
does
told
get
me
more
way.
successful than that.
Oh my God, yeah, the transportation company that went public, and he's just a brilliant guy. He told me way back when, he said, "Don't decide what you want, decide what you don't want, and not what you'll do, what you won't do." And it's been really, really important for me.
It's great advice.
But yeah, but going forward, I think that had I not gone through that experience, I would not have been such a good teacher. Yeah, I feel lucky. The first year that I was a teacher for the residency, I got Teacher of the War year.
That's amazing.
Yeah. So it's
That's the ultimate gift to give back.
It
It's
is.
It
It
really
is.
is. Like
It is.
sharing your knowledge and making people live their dreams, or
Right.
think of the impact you're having.
It's
right.
rewarding.
It is.
Very
It's really
rewarding.
wonderful, and it's kind of like if you're a guy that or a woman that beats yourself up like I do in terms of never being good enough. Plastic surgery is the perfect kind of thing because it's almost never good enough. It's you're trying to perfect something that you're dealing
We don't
with.
tell your patient after.
No, you don't
looks
know.
good.
You're waiting. I mean, the old me was that the old me was if I saw something I didn't like, I would mention it. I don't mention it anymore. I want them to mention it. You know what I mean? Yeah, but it's a fascinating field to be in because there really isn't perfect, but you get better and better and better at it.
So let me ask you something
Yeah.
fun. So, I'm around you socially all the time.
Yeah.
So like you're around people, and do you like study faces to this day? I'm like, oh, I can fix that. Like, is it almost like if you're like in entertainment and you're watching a television show, like you're redirecting, or do you not do that?
I'd have to say yes, but I'd have to say I try
can't
not to
help
be
it.
I try not to be working all the time.
Yeah.
But I do find myself just looking very, very briefly.
Right.
And what really entices me is when I see somebody who is incredibly beautiful, incredibly handsome, and it's just amazing to me because what are the chances genetically of that happening?
Right.
I mean,
Right.
a lot of that stuff I can do, but when somebody naturally gets that, you're like,
That's
oh
it.
my God, it's just fascinating, right? Yeah, it's fascinating.
Yeah, you win the award.
Yeah, no question
the genetic
about it.
lottery.
No question about it. Which
I always say like there's like different types of charisma, and like people can have multiple charismas.
Yeah.
Like, I call it this inner genius and things like that.
Yeah.
So like one of the charismatic qualities is beauty.
it
And
is
so,
it's an
it's
incredible
like-
commodity.
Yeah, I mean, people, some people are lucky, the genetic lottery, and
They are.
they're so beautiful, they may have nothing else, or they get whatever they want. They walk in the room, and that's it.
And Mike, that's what I deal with a lot.
Right.
I deal with a lot of people that have been attractive their whole life, and it's not as though people are confused when they think that when people come into my office and they want my services, and let's say they've been beautiful or handsome their whole life, it's not vanity, it's their identity.
Sure.
So
wow.
they're
This is
used to
great.
having certain things, and it's not selfishly, but it'd be like having a NBA player wake up and be my size. You know what I mean? I'm just telling you that's what happens when people that are beautiful or genetically gifted that way, and that's fleeting
And
for
it's
them.
fading.
It's
So-
fading because it affects their disposition. It affects their outlook. It affects their expectations. It affects so many things because that has been a huge part of their identity.
That's
Yeah.
interesting.
Yeah.
They're like, I've
Yeah.
had this my entire life. What's happening to me? It's
Well,
like,
yeah.
over time.
Can you
And-
feel like
and-
you can fix that?
I do. I see it every day where all of a sudden I'm able to, and it's when it's done well. I mean, you guys hear this all the time. You don't see the great plastic surgery. When it's done well, you should
don't
be able
notice.
to tell. Nope. I mean, you could look at a before and after, and it could be amazing. But I have people that the before and afters are amazing, yet they go and they see their family or they see their friends. Their friends can't put their finger on it. That's good stuff. And that is the stuff that keeps me going because that is the greatest gift that I can give somebody is that feeling of vitality and confidence again.
Yeah.
And just it's I'll put it I put it this way. And you're young enough that you get this. I'm old enough that I remember. So remember when you're 29, 30, getting ready to go out, took you no time, and you look in the mirror and you go, I have it. Well, what I give back to people is that
Right.
that feeling
I like
of
that.
It's
it.
amazing.
Yeah.
God, I wish I ever felt that way.
No, same.
I don't like look in the mirror and like,
Mike's like,
oh,
I gotta make a stop at the
Yeah, I look at my son, he's got it. Yeah, I never had it. Right.
Dr. Dan, I am a really big TV and movie guy.
Yeah.
I'm all about it, and especially all these celebrities out here, especially
Yeah.
in the place that we
Yeah.
live. I'm wondering, we've talked about you growing up and being able to spot
Yeah.
faces that you just thought were just true natural beauty.
Uh-huh.
We wanted to ask, who in today's society, which celebrities would you say have some beautiful natural faces, or just
Got
faces
it.
in general?
You know, what's interesting is that, and I'll extrapolate this a little bit, when people come in for what I do, it tends to be, it's a global world now, so ethnicity is something that is embraced now, as opposed to theoretically looking different. People embrace it much more now, so the standards are different than they used to be. And when somebody comes in for some work, or maybe a young girl comes in for rhinoplasty, I try to look at their features and I try to find out what it is that they want, but also I try to embellish their great features. So somebody who looks Persian wouldn't look good with a fine little pointy nose.
Sure.
So you want to give something that looks kind of exotic. But with that in mind, who do I think? I think that and they don't have to be contemporary stars. Like, I don't know why, but I was surfing the other day and I came up with a picture of Ava Gardner when she was like 19. You're too young. She's just beautiful, just a naturally beautiful woman. When we talk about getting the luck of the genetics, one of my favorites is somebody, her name is Monica Bellucci. She's an Italian actress.
Yes.
There are, and I have to also say, when you meet, and you've met a lot of celebrities, you have to be pretty freaking good looking to be good on camera. That's just the bottom line. So people forget that when people are celebrities and are on camera, they're pretty good looking, whether it be the bone structure, whether it be just of how the symmetry is on the face. What also is interesting is that when people are imperfect, sometimes they're more beautiful. If you look at their faces and they're off a little bit, it makes their faces more interesting. But I see, standard-wise, I think that, for a man, I hate to admit it because my wife's favorite guy in the world is Tom Brady. Is like a super handsome guy. It's like sickening.
Okay, right? I mean, everyone
He's
does.
just
win
beautiful.
at
handsome
anything,
guy.
Yeah. And there's 1,000
too
guys.
lucky.
He's just too lucky. There are 1,000 guys walking around like that, though. They're just not famous. Actresses wise, I mean, there's a ton of them, and it depends upon what you think is beautiful. But usually we tend to, people that photograph well, or people that have really strong bone structure, that have a lot of symmetry in their face. I mean, you've got a huge amount of symmetry in your face, so you're pretty
There you go.
photogenic, bro.
There you go.
See,
Mike and I, we need help.
Yeah, we do. We definitely need help.
No matter what, we got to keep that clip, okay? Because that just made my day.
Right on, bro.
I also forgot to ask, do people ever, or do clients come in and say, with like a celebrity's face, like, I want to look like this or this feature? Does that happen often?
Great question.
Or no?
I actually encourage that.
Okay.
So when people come in, and especially like something artistic like a rhinoplasty, I will take photographs and image their nose to show what I think I can do for them. But then I also want them to bring in half a dozen noses from the internet, being celebrities or models, not before and afters, but I need to know how they put together an outfit. So I want to know what they think is beautiful. That way I can integrate it into the plan that I do.
It kind of helps you envision it as well.
I want them, it's not what I want, it's what they want.
Exactly.
But people's, perspective is different, but I can't tell you how much it's especially with younger people, how much it is influenced by social media now. So if I have these, let's say Persian patient that comes in with like a horrible nose, and they show me a picture of like a Kim Kardashian nose. I mean, I can only do so much. I operate with a scalpel and not a wand. You know what I mean? So, it's
not
just
fully a miracle
yeah,
work.
exactly.
I'm just trying my best here.
I wish, yeah. But yeah, there's just, and there are equations actually that have plotted out what makes somebody beautiful and not. I mean, there are mathematical equations.
Wow.
In terms of proportion and things like that. But it's
It always
pretty,
comes down to math. Doesn't it? No matter
always
what,
comes down to,
it always comes down to math.
Yeah, exactly. Yeah.
That's amazing.
This is an interesting thought. I always say things like, sometimes you see the most beautiful people and their personalities are so bad or they're just not nice, they become the most unattractive people you've ever seen rapidly.
Glad he talked
and
about
sometimes
that.
people are just not physically attractive,
No.
but they're so beautiful in what they do that they become attractive. So
Right.
it's like really interesting.
Or they have a lot of money.
They have a lot of money, right? There you go.
I'm glad he talked about that earlier, though, saying like, don't lose your humility
Right.
post surgery.
Oh,
We'll
yeah.
he'll do this amazing work, an amazing job for them, then all of a sudden they'll get cocky or get mean.
Right.
It's like, no, the person you walked in here as, like, nice
Right.
and kind, be that same person. So I'm really glad that you mentioned that earlier, because that's a message that a lot of people need to hear.
Yeah, absolutely.
And I gotta ask a crazy question,
Please.
and I'm sure you've been asked it before.
Uh-huh.
Is there a certain procedure or operation that you see as by far the hardest to do or the most difficult, especially for newer physicians or doctors or anything like that?
Yeah,
Like,
well,
what would you say?
that's a great question. It tends to be, and it's funny because if I go somewhere and people find out what I do, it's good for about 20 minutes of conversation. You know what I mean? And it's
Great
funny.
icebreakers.
But when you look at a plastic surgery career, usually plastic surgeons will operate generally on people that are in their own age group, if you will. So the younger plastic surgeons get the younger patients that most commonly are doing things like breast augmentation, tummy tucks, liposuction, whereas the more mature surgeons are doing things as their population grows, things like facial rejuvenation, facelifts, rhinoplasties, and things like that. If you're a thrill-seeking kind of guy, and that's kind of like got me into my drinking thing, okay, is that I like the facial stuff because it's there for everybody to see, and it's very technically difficult to do. The other stuff is a little bit easier.
Okay.
But there's one of the problems these days is that with social media, and it's here to stay, is that it has made what we do a lot of ways a commodity. So people view it as, well, I'm just going to go get some plastic surgery done.
Wow.
And it's still surgery. I mean, there's still risk and possible complications, and a lot of times it's permanent. So
God, I think
I've
this is
never thought about it
messaging
like
you should
that.
be doing on social media. I
yeah,
like this.
well, a lot of
I
people
like
do.
this.
Yeah,
Wow.
but I mean, it's still. But with that being said, it is really amazing, like we said, how it changes people. And those decisions you make, are kind of permanent. So we talked before, it tends to be regional. It tends to be, things that are appropriate in Scottsdale or Los Angeles might be a little bit different in New York or Chicago.
So there's regional. That's
There
wow.
are. There.
So there's the regional
Fascinating.
definitions of beauty, or regional definitions of what they want, or
I think that
for granular
the,
Maybe the
behavior.
norm or
Well,
what's
yeah,
more acceptable.
I think that what is appropriate. So there are areas in the country where people wear less clothes, the Sun Belt, if you will.
Yeah.
And those tend to be areas where people are going to be more prone to have, maybe a little bit larger breast implants. They're going to have more apt to have more liposuction, things like that. Whereas it's not like that in places like Manhattan. There are places where people are more free to talk about plastic surgery because it's a fact of life now. And in fact, sometimes I'll go to other cities or the Midwest and I'll see older people. I'm like, oh my God, that's what older people look like.
Right.
I'm like, oh my God, I forgot.
That's why I love getting up to plane in Chicago, and I like, it's my people. Everyone's a little overweight. And it was like always like
Right?
eating hot
Yeah,
dogs.
right,
and like,
right.
my people.
But it's a strange sort of thing. But because of it's become a commodity, people forget it's an art form.
Yes.
And there, just because you can do something doesn't mean you should do it.
Wow.
And that's where I think it's a responsibility for us as plastic surgeons to talk to people about, maybe you should think about this a little bit more.
Wow.
And that's where we end up turning away patients.
Dr. Dan, with everything that you just touched on as well, I wanted to bring up something because, there's a big show that just came out that everyone was talking about, Love Island,
Right.
USA specifically. I know
Yeah.
a lot of people talk about UK as well because both those been blowing up. But my girlfriend just had me watch all these hours of this crazy show, and I'm like, what are we watching? But I just remember seeing clips going viral talking about the plastic surgery that was done on some of the contestants on these shows. And so I kind of wanted to get your take on that about the age range of people who are so young and choosing, like
And
you
these are
said,
people in their 20s?
yes, yeah.
Okay, really
We're
young.
talking like 21, 22, 23.
Wow, really young.
And, people who universally, I think most people are like, oh my God, you're already beautiful, you're already gorgeous. But they
Right.
come in there and, even people are like, oh, without this, you probably would have been on the show or anything like that. But, what is your take on what's acceptable in terms of the age range? And I love that you mentioned it earlier, like, hey, let's discuss this further of whether or not this is something you want to do because this is permanent. This
Right.
is forever. This is a
Right.
life-changing decision.
Right.
What is your take on that?
My take on it is that everybody's situation is different.
Yes.
So, what's good for me might not be good for somebody else. So I think that in a younger patient, I think that people need to be cognizant of what the possible consequences are, because norms of beauty change.
Yes.
Not that much, but they change. And also, we, as a group, I think plastic surgeons feel that the motivation should be from someone themselves as opposed to secondary gain.
There we go.
And if in fact somebody's doing that to further their career, I understand that in some fashion, because there are newscasters that want to stay relevant.
Yep.
There are actors. I mean, you can't believe how many actors and actresses have had rhinoplasties, their nose is done, that you can't tell until you look at a before and after. But
Exactly.
those are necessities of the field. I mean, being employable, things like that. But doing those sort of things for a situational reality show, I get it, but it's an important decision. Yeah, we feel also when you're talking about plastic surgery, unless somebody's really young, it's not always the age presentation chronologically, it's presentation physically.
Sure.
Okay.
So there could be somebody who might have bags on their lower eyes that runs in the family.
Okay.
And they could be in their 30s and have their eyes done.
Got it.
And that's completely acceptable. Whereas, somebody who's 22 and wants to get a full body makeover, that's a little
crazy.
bit harder to accept
Yeah, that's
sometimes.
crazy.
Yeah.
So talking about social media and the
Yeah.
commoditization of plastic surgery, or this common practice,
Yeah.
I want whatever this form of beauty is. We've talked about this. How do you feel about sort of the fact that somebody's better at marketing rather than their skill set is then people are going to them? So, like, in other words,
Got it.
it's being destructive to, like,
Right.
you're like incredibly competent, had all the education, and you're not seeking out that social media spotlight, but then you watch some of these other people, there are television shows,
They do.
and they're incompetent. I mean,
Well-
of course, this is my opinion.
No,
but
it's not just your opinion, Mike. I mean, studies have shown in our literature that now, as a plastic surgeon, your social media presence is more important than your experience and where you've trained.
Wow,
Oh my
that's
gosh.
nuts.
That's
Amazing.
scary.
It is.
That is really scary.
That's a
It is
crazy
scary.
thing.
So
Wow.
just like anything else, I'm sure that you know people or people that know somebody who's very well heeled financially,
Sure.
or a celebrity, and they've gotten plastic surgery and they look like crap.
Yeah. We
But
do.
they surround themselves with people that are yes people, or their friends are in the same circles. And why would they do to themselves?
Exactly.
It's how they get their information. So it is frightening about the social media now, because everybody posts themselves as experts. And remember how we talked about trying to survive. So when younger plastic surgeons get out now, I mean, it's easy for them. They're very facile at social media, much more than an older person. So it's necessity for them. So if they project that they're experts, they're going to be a little screwed when their results don't match people's
Sure.
expectations.
Exactly.
So it's almost like it's going to be a little bit of natural selection over time for these
Do you
people.
fix these problems? Like someone
All the
goes
time.
so they come to you afterwards.
All the time.
Is it harder to fix? Like, is it a disaster, or like it's fixable?
Yeah, I do a lot of that, but it's fixable. But you're really, your best shot's the first shot.
First time, all right.
But there's untold collateral damage from that. There's the recovery time. There's the emotional trauma of having had a bad experience,
Sure.
and then also the technical challenges of fixing something that may have not been done well.
Sure.
Wow.
Yeah.
Like I've never watched Botched, but I was wondering if you watch shows.
Oh
like
yeah,
that.
I know. Once in a while I watch that,
Yeah.
and a lot of it's true. Like any reality show, they're trying to sensationalize that, but
Exactly.
but it's real, and a lot of these. A lot of these people that come to me, were referrals that they saw on social media or had friends and things like that. And you can't argue. I mean, people make honest mistakes that way, but it's tough how people get information now.
Sure. I mean, what would you do, like, as far as somebody seeking out for various reasons? What would you ask the surgeon, or how would you vet that?
Well, it's a great question. So one of the hardest things that we do is a rhinoplasty. That's a nose job. Because,
As a side shot, I probably need one.
I didn't say that.
I'm kidding. I'm
No, Mike, you continue
good.
to grow into your nose.
Yeah, there you go. My
It
head's getting
looks
bigger and bigger.
good.
Right? Yeah.
So, but what I tell them is that they come to me a lot of times from word of mouth or on the internet. They look at before and afters. I tell them, if I was having this done, I would find somebody who does a lot of this, and you like what they do. And it should be pretty much that simple.
Wow.
To find out, because people know what looks good and doesn't look good, as opposed to.
So is it the before and after that you're
Yes,
looking for?
yes, yep.
Okay, interesting.
And what's interesting is people are more demanding now because of the internet, and people sometimes don't realize that their standard that they look at is false, because almost all the photos that people have are filtered now.
Wow.
I'm not talking about before and afters, but if people are following celebrities, they're filtered.
Yeah.
Right, it's not real.
Yeah, it's not real, and it's a different world now, because even my patients that have had a rhinoplasty are taking photos of themselves all day long at different angles that are a little bizarre. But they do it. That's the reality now.
Yeah.
Right.
So they are constantly taking photos of themselves, and they notice something, and they don't know something's been filtered in a celebrity or an influencer, and that's the reality now. So it's a different world now. So perfection does not exist, but people forget that.
With a lot of these cases for the rhinoplasties and the nose jobs, is there a solid ratio of people who are only getting it done because they broke their nose, or no, is it all elective for you?
I'd say for every person that broke their nose, there's 95 that wanted elective.
Got it.
Yeah.
Okay.
Yeah.
I've
Yeah.
always wondered that, because I heard that before. They're like, oh, if you break your nose, then you automatically like.
No, it's like
what?
no, you would fix it if you
Got
had
it.
trouble breathing or
Okay.
you didn't like the way it looked. Yeah, yeah.
I broke my nose.
Oh my God!
I didn't
How
do
many
anything.
times?
Don't get started.
How
Don't
many
even.
times?
The first time was when I slammed into the back of a cab in
did?
New YorkIty.
Wow,
You're
I wrote a
serious?
paper on that.
Yeah, I was in New York City. And,
That's the old cab where you put the
the
money
old
through.
cabs. There were
yeah.
these like plexiglass. or that.
exactly.
I think it was like bulletproof glass or something.
Oh, this is
And
old
I was
school.
with Tara. I think we were
Yeah.
in Manhattan, and the cab drivers were like wild. And Tara didn't say anything to me, and so we slammed into the car in front of me. And it's like she braced, I didn't brace, and I went right into the.
And this is why
Into
Mike
it.
only does Uber or Lyft now.
Yeah,
There you
so,
go.
Yeah, I'm not.
Mike, that is a great story. When I was a senior resident in plastic surgery, I was in Manhattan, and we would go to a conference, and all the senior residents would present papers. And my paper was on New York City taxi cab injuries.
wild.
And I was the only paper that got the standing ovation.
Wow.
Yeah,
way.
because everything else was scientific and boring. Mine was like
Like
really
real
cool,
life
real life stuff.
And I went to
Yeah.
St. Vincent's, which is a trauma center.
I know that.
And I was
Yeah.
like sitting in this,
Yeah.
like, people were being shot. I mean, like, this
Yeah.
was not a fun experience for me.
Yeah.
I thought you were messing with us when you said that. I didn't know you were serious.
Oh, I was serious.
Oh
I hit it. I literally hit it. Broke my nose.
That's
And
crazy.
It was common,
They're
yeah.
bleeders. I mean, you look like it. You know,
Yeah.
the-
Yeah.
like I remember Tar looking at me, and then they pulled me out, and the police came, and they ordered an ambulance. I'm fine. Meanwhile, I'm bleeding everywhere.
Oh my God.
So
got it.
yeah. So anyway, they didn't fix it at St. Vincent. A level 1 trauma center.
I didn't know that
Fix your
question was
nose.
going to strike a chord, Mike. I'm sorry.
Yeah.
Right.
So, Dr. Dan, with this wealth of knowledge that you have
Mm-hmm.
and everything we've talked about in regards to your experience and your learning, and especially the stuff that you brought up with your mid-career and everything, I wanted to know, like, if you weren't doing plastic surgery, what else would you have chosen for your life, or what would you look back at and tell that young entrepreneur in yourself, the business side? What would you change?
Yeah. That's a tough one because, what I know now, I'd probably be a developer,
Wow.
like a real estate developer.
Really?
Yeah,
Wow.
because
you
you
still can do
create
that.
things that are, what's that?
You can still do that.
I know. Let me tell you. I said my son's in real estate development at
your son,
USC.
USC.
It's plastic surgery is a very different kind of field because it blends so many things. It blends business, it blends medicine. With regards to business, there's a lot of marketing there. So it was the right thing for me to do. I have to say, the older I get, the more jealous I am at developers that have like a long-standing representation of what they've done in terms of the development. And you're providing shelter, you're providing experiences, and I know a lot goes into it, and I know the grass is always greener. Okay, I love business, and one of the ways that I've given back is that I train these residents, and when they come to me, I still kind of believe in that the training should be a little bit tough. So I'm always riding them in the OR in terms of their technique, and I want them to be better.
Exactly.
I think the greatest gift is to want the person you're teaching to be better than you are.
Exactly.
Okay, and consequently, I give them a whole library on plastic surgery literature and books. If I'm doing a tummy tuck, I need them to read about a tummy tuck. That's an abdominoplasty, or a facelift. They need them to read about the anatomy and things like that. But the 2 books that I give them when they leave are not medical books. They're business books.
Wow.
Because
That's
nobody teaches us in training how to think that way. So one of them is a very famous book by a guy named James Collins. It's called Good to Great. And it looks at specific corporations that are gold standard and how did they get there. And they talk about building the business and employing people and getting people on the bus and then finding out where to go. So you hire the best people. And the other book is about building a business climate. And that is the book called Principles by Ray Dalio that talks about transparency with people, about having a forum of ideas where no one is afraid of giving the idea. And there's really there are no tiers of expertise. Everybody's basically the same. So it's like a meritocracy. But if I could do it all again, and I didn't do this, I would love to have been a developer.
Wow.
Yeah.
But you're kind of doing that with people.
Well, kind of.
Yeah, you really are developing people.
I mean, yeah.
Like, it's similar.
Right.
It's a similar thing.
You know,
so you
but I
like
was-
the legacy aspects of it. Like
Yeah,
this
that's
building's
the
up for 100
greatest thing.
years. So.
Well, here's what gets old. So I do mostly face stuff, but people ask me, "What do you do?" I go, "I'm a butt doctor." They'll go, "What do you mean? I thought you do faceless rhinoplasty." I said, "Nope." I say, when I see a patient, they'll say, "I love everything but."
My butt.
No, but.
No,
I don't like this.
Oh, a butt doctor.
Okay.
I got
Yeah,
it.
yeah. So it could be a little
Interesting.
wrinkle here, it could be a little wrinkle there, and that's one of the fun things that's tough about us, is that you change people's lives, but people get used to the new reality. So they forget where they came from. So
Wow.
people forget they continue to age,
Wow.
and things. It's tough.
I mean, I've been around you, and I find it interesting. Like you become somewhat of omnipotent. Like I've been around you with people. Obviously, never disclose who you've done surgery on.
Right,
as
right,
part of
no,
private
no, right.
practices, but like I've been in social circumstances where clearly you had done the surgery, because people will come up to him and be like, it's almost like the Pope has walked
Well,
in,
no, a lot
or
of that's because
the
the
Dalai
checkout-
Lama,
That's
or
the checkout line
right.
at the
I'm like,
supermarket.
wow, look at that.
People are still fascinated by plastic surgery. They really
so
are.
I think
And I think that I think that humility is a really important thing, and I think people expect you to be a certain way, and I think when you're not, I think it's a nice surprise for people.
That's great.
Yeah. But I love the book, guys, and it's just the lessons I find after reading it and listening to your podcast.
Oh, thank
I'm
you.
amazed. I'm just amazed at the parallels. Without me thinking about it, you've articulated things that I say or try to do.
Literally.
Yeah, and
So-
I wish I had been your father's kid too.
Yeah, there you go. I know you've worked on like really famous people. Of course, you can't disclose that. And so,
Right.
what is the psychology of that versus the psychology of somebody that's not in the public eye all the time?
Right.
So, how is that different? Or is it not?
It's not. I find that it's like going into a great hotel. Hopefully they're going to treat everybody the same, and that's being in the luxury business, in the hospitality business. So no, I really don't treat them any different. I know that for me it's fun because I know the expectations are higher, and if there's somebody who's in the public eye, everybody's going to be looking at it. So that's fun for me. But inherently, no, some of the greatest patients I have been celebrities, because I think that they understand that their livelihood, either in their own mind or practical applications, it's really dependent upon their longevity or the way they look. So I really enjoy it. But you're getting into also the psychology of what I do in terms of how do I pick the patients. I often will tell patients when I meet them that I'm interviewing you just like you're interviewing me, and I want to make sure it's a great fit. And I hope this sounds appropriate. I also am looking for patients that hold themselves to the same standard that they're going to hold me to. So that's one of the things that I look for when people come in. It's not as though they have to be, dressed to the max or anything. I just, maybe mentally, I'm looking to make sure that people are at the appropriate place for me, that they don't have any dynamics that are going on, like a recent death in the family, or like we said, secondary gains they're looking for, like they're looking for me to change their life.
I see.
Yeah, that's not something that I want to get
wanna
into.
do.
But the psychology is incredibly important, and I want people to be excited about this. I mean, it's a great thing. When done by an appropriate person, it can be really life-changing, and that's a gift for me too.
That's great.
Yeah.
So, what's the best way to reach you, or what is the best way to follow you, Dr. Jen?
Yeah, how does someone use you?
Usually, yeah. I mean, I have a whole bunch of YouTube videos on there, and it's interesting. This is talking about, business-wise. This is way back when, maybe in the mid-2000s, I would take my kids on the weekends to the office, and I would make 10 videos, just granular videos. At the time, because I thought it was, kind of ahead of the curve, and it was. So, I have YouTube videos. My office, my website is ShapiroPlasticSurgery.com.
That's a great name, by the way.
Yeah. Thank you,
Love that
brother.
name.
Thank
We
you.
love
Thank
that
you.
name.
So yeah, there are easy ways to reach me. They could just.
Do you know
Google
what
me.
Shapiro means? Do you know that? There's a meaning to it.
I have no idea.
And so a rabbi told me this, so I have no,
So
have
it's
no way to
legit.
validate.
It's
What does
legit.
it mean?
Yeah,
It's
'cause
legit.
now I
I don't
got-
have a way to
now I gotta
validate it.
know, what does it
But
mean?
Shapiro means beautiful from within.
Get out of here!
Yeah.
I'm getting a tear in my eye,
Wow.
bro.
I'm not-
This was the perfect episode to
Yeah,
talk
really,
about
yeah.
that.
I love it. Right?
I'm
Yeah.
glad you waited till now.
So
to
that reminds me of really important. The way to think about this, about what I do, is beauty is not in the eye of the beholder, but in the eye of the beheld.
Oh, wow. I like
Yeah.
that line.
Yeah.
I like that a lot.
That's true.
Yeah. The other thing that's really important, this is kind of fun, is that as I've learned, like in 30 years, what I do is tough because people are always concerned about what people are going to say.
Really?
What are people, how are they going to react to what they've done? And what I've learned is that when someone has something done, it's not how they look, it's the way that they look and how it makes other people feel about themselves.
Wow.
Does that make sense?
Yes,
Yeah,
it
totally.
does.
Yeah. So
it's a
people are
human
concerned
interaction.
with themselves. They're really not looking at what's done. They're thinking,
Right.
you know.
That's so interesting.
Yeah,
The
yeah. There's a lot of
psychology.
psychology. There's a
Never
lot of
thought about that
psychology with
before.
what I do, and that's what makes it tough and what makes it so rewarding.
Yeah, that I always try to teach people, like, it's paralyzing to worry about what other people think.
Correct.
And so it's just really is. I mean, obviously you want to be a good person. You want people to say that you're a good person, but what does that mean? So I always make this joke. I have like a 51% approval rating and I'm doing really well.
Like, yeah, no
So I
question.
think that, like, if you can not have that, I mean, I think everyone has that. It's impossible to get away from that. But if you can go away from that, not worrying about what people are thinking, you become much better at everything that you do.
Everything.
And you become much more successful, and you also become much more confident in the psychology of what you do. It's probably
Right.
the best person for you to do surgery
Right.
on. Like, it's okay.
Right. Right.
Hopefully it enhances. If it doesn't, we're good.
Right. Yep. Great point.
This was incredible, Dan. I mean, not
Thanks,
only
Mike.
you a great friend, and I'm honored that you came on this
I'm honored to be
show, and your extraordinary career and all the business success, and all of the trials and tribulations. It really is a testament to how incredibly successful and how much you deserve that, and what
Thanks,
you're
Mike.
doing to make the world a much more beautiful place,
what
inside
I
and
do.
out. Remember the
Yeah.
last name,
I know,
Shapiro.
right?
Beautiful from
There
within.
you go. Beautiful
So, but
within.
thank you very much.
Thank
I
you.
love that. Yeah, Dr. Dan, thank you so
Thank
much
you,
for
Rodney.
joining us today and taking the time to do this. I mean, we've learned so much, and for you to enlighten us and our viewers, it just really means the world. So thank you so much
Appreciate
for stopping
that.
by today.
Thank
All
you.
right. Yep.
So, Mike, first, thanks for having Dr. Dan here today. I mean, that was a phenomenal guest, and I could tell why you guys
great. Yeah.
have been such great friends for so long.
Yes.
There were two key takeaways from our conversation that I got today.
Mm-hmm.
First and foremost, when he mentioned being comfortable, being uncomfortable.
Mm-hmm.
And that's something that's huge for me. And I know that we've talked about it before, especially like with the book and even our very first episode, but something that just resonated with me because even growing up with football, that's what we always talked about, because everything that we do with that life and, being a student athlete is just so stressful. It's like a whole nother job, right? You're waking up at 6 a.m., working out, games, field, practice, tape, all this stuff that you have to look back at, right? And I'm like, oh my God, I don't want to be doing this at 6 a.m. But as uncomfortable as it made me, I was like, okay, I need to be comfortable in this space because that's what's going to lead me to be successful in this space, right? And so I'm so glad that he brought that up again. And then the second point is still having that humility and being humble post-surgery, right? Like a lot of people will come in, kind-hearted, gentle spirit, whatever it may be, and then they have this beautiful surgery done and they instill that confidence back within themselves, but it might be too much where it turns into cockiness and they actually lose that humble part about them that got them there in the first place, right?
Right.
And so that's something that's like really sad to hear, but I'm so glad that he brought that up because a lot of people need to hear that message like, hey, the way you walked in and still were gentle, kind, respectful, that's how you should be leaving too, knowing that you have all that confidence back within you. And Dr. Dan does this amazing work on you. You should still leave with that respectful factor. So I'm really glad that he brought that up.
Yeah, that was great. For me, obviously we're old friends, and so I know him in many stages of our lives. And so I thought was really interesting is how much of a business plastic surgery is, and literally following the same blueprint I did as far as becoming successful and making it from either having stumbles or not, and what do you do and what's the pivot like. But I also thought like the psychology of what he does was really interesting to me. Having somebody prepared for the dream of plastic surgery, like a dream maker, but someone has to be prepared psychologically for that. Like what is the position they're in, and will he be successful in creating what they want? So the end result is exactly what they want, or how do they lift their spirits? And I think that what he does for a living is like an incredible ability to help people gain back confidence or have confidence or become successful in whatever career they are. So he's giving people tremendous dreams and hopes and capability, just like a great coach would be, and giving someone confidence,
Which he
like do
does
the
as well.
following things. So it's like the physical nature of which we can't ignore. I mean, the physical nature of people's presence.
Yeah.
And how do you get to that delivery? So
Yeah.
I thought it was really interesting, and just a fantastic interview. I really enjoyed this.
100%.
So,
I'm really glad that he reiterated that too, about the importance of having that confidence back within you, but still being able to move forward. And the way that he brings that to people is just so cool, and how rewarding that is for him in his life as well. So
absolutely,
it's really cool.
Yeah, absolutely. Well, it's been an honor to have him on, and also to be his friend, and really enjoy listening to in depth, because you'd really as friends you don't really do that. It's really kind of interesting.
I mean,
you don't really like ask somebody for an hour like in depth questions, because that would be ridiculous. They would be annoyed.
Yeah, especially as men, and especially knowing somebody for so long, like you don't always get that deep and talk about like, oh well, what actually brought you here? It's like, oh, what's up, man? Did you catch the game yesterday? Like, no, like we want to have these in-depth conversations.
It's true.
So it's amazing that you brought him here today. He's a
good.
phenomenal guest. See, Mike, you see what I love about Read the Tape? This is almost like a therapy session now.
There you
get
go.
a mic and a camera, and we get serious. We get deep, So this is what men need, is to be more vulnerable, open up a little bit, We're not even getting emotional, but we're just having a real talk, and I love that conversation.
That is how I was raised. I was raised to be very emotional and very honest and open. And that's really what it's about. I think that's how we as humans should interact. So I'm glad that everyone's following suit. So I'm not the original here.
No. That's why people are coming to read the tape.
There you go. That's right.
That's what they want to see. We're opening up here. That's what we do. Thank you so much for coming back to Read the Tape. Please join us next week's episode, all right? And if you want to like, comment, share, subscribe, please go ahead and hit that button as well. Thanks for joining us. We'll see you next time.
Thank you very much.
I just finished an amazing podcast with Mike and Rodney called Read the Tape. Great content, and I'd love to share this with you. If you want to learn more about my practice, about what I do, and about how I've succeeded, go to my website, shapiroplasticsurgery.com.